Well, a bill making its way through Congress includes 54 proposals to lower out-of-pocket costs for health care and more. The plan will ensure patients get medical bills in a timely manner and help crack down on the issue of surprise medical billing. Morgan Wright reports.
They're deciding between a copay for a medication that's $8 and putting food on the table for their family.
Rebecca Kirch with the National Patient Advocate Foundation says that's the reality for patients she interacts with.
Financial distress is a major factor.
Kirch says her organization and Congress have their work cut out for them, but she's encouraged by recent action in the Senate Health, Education, Labor, and Pensions Committee.
Senator Enzi and I had a bill that became part of the larger bill we voted on today in committee, which is to first of all say that we give people more notice in terms of the bill arriving.
The Help Committee voted and approved bipartisan legislation that would reduce health care costs, end surprise billing, add more transparency, and increase competition to bring down prescription drug costs. Pennsylvania Senator Bob Casey says his legislation within the bill package would help crack down on outrageous medical bills from landing in the mailboxes of Americans with little notice.
There's not nearly enough attention paid here to getting health care costs down and getting the cost of prescription drugs down.
If we don't first focus on how can we help patients and families understand the financial liability, we're not going to get to our ultimate goal of making sure that people get high quality care.
The committee plans to present the package to Senate leadership this month for the full Senate to consider. In Washington, Morgan Wright.